So before I introduce my guest for tonight, let me give you an idea of what has been reported for this week. And let's start with City Newsroom because it's latest on the COVID-19 story. It says Ghana's coronavirus case count rises to 132. We still stay with the City Newsroom and bring you the latest from Parliament and indeed the Finance Minister on this disease. And it says Finance Minister ordered to assess economic impact of potential lockdown. This is information Minister Paul Nkrumah speaking over there. They move to Daily Graphic because it says mighty contract COVID-19. A picture of Prince Charles and Idris Alba, who have all tested positive for the virus. Daily Guide says Nana Lord's Market women. He had a meeting with them this week on the way forward on this disease. Let's go back to City Newsroom. They have another story there. They say enforce, quote, stay at home, unquote, policy to combat coronavirus, UTAC to government. Let's go to a newspaper in Ghanaian Times. It says Jack Ma's test kits, PPEs arrive. Government takes delivery of 20,000 test kits, 1,000 PPEs and 100,000 masks. Let's go to the Chronicle. It says, pressure mounts on government to declare total shutdown. City Newsroom, coronavirus, we will consider all options before announcing lockdown. This is Nana Akufo-Addo speaking on calls for a shutdown. Ghanaian Times, Accra at standstill as Greater Accra MMDAs undertake massive disinfection of city's major markets. We go to the Chronicle. It says Okada riders smuggling foreigners into Ghana. Let's go to another newspaper, the Daily Graphic, and it says immigration on high alert as 12 Okada riders arrested. Let's move to the Finder if we can, and it says COVID-19, go for lockdown if it is necessary to protect Ghanaians. TUC urges government. The Custodian, Parliament in partial lockdown over COVID-19. The Herald says Comfort Noche Teaching Hospital quarantines 20 health workers over contact with deceased coronavirus victim. We go to City Newsroom, COVID-19, one patient recovers. We still stay with City Newsroom because it says EC suspends upcoming voters registration exercise. The Daily Statesman, impending voters registration on hold, EC to come out with new date. Back to City Newsroom, EC using COVID-19 as cover-up, equipment for registration not ready. This is Asedu Nketia speaking. City Newsroom, John Boydu justifies suspension of voter registration exercise. And then Daily Graphic says voter registration suspended. NIA, let's go to the issues to do with the NIA on the registration of cars, but still related to the COVID-19, and go to City Newsroom, and it says High Court grants early hearing to case against NIA's Ghana card registration. This came out this afternoon. City Newsroom still, Akufo-Addo's ban on public gatherings doesn't include NIA. This is Attorney General defending the registration by the NIA. The Informer says, after being dragged to court, murderous NIA succumbs. And let's end with the Herald. It says, Akufo-Addo preoccupied with 2020 election. Deputy Attorney General reveals why President omitted NIA from ban on public gathering. So these are what the papers and some online portals are reporting for the week. So let me bring in my guest for tonight. I have with me Bernard Avle. He's the General Manager for City TV and City FM. He's also the host of the City Breakfast Show. I also have Selorm, Adonoo, Head of Features and Articles here at City FM and City TV. Gentlemen, welcome to What the Papers Are Saying.
Thank you.
Thank you, Vivian.
Right. So today, the numbers went up again, spiked to 132, and I think last week we were trying to pray or hope that the numbers won't spike this much, but unfortunately, it's gone into the hundreds. And if you speak to persons in the know of the matter, they believe this will move higher. Selorm, let's start with you.
Yes, I mean, certainly the numbers will move higher, and that is what it is. I mean, it will move higher because people got into the system with the disease. Maybe they were asymptomatic, which means that they did not manifest any signs or any symptoms that indeed they had this disease. So you know how we behave in Ghana when somebody travels from outside, indeed, because a lot of the initial cases and almost all the cases have been imported, save just 2 or 3. When people travel from outside and they come back, we hug them, we want to be in close contact with them, we want to ensure we are around them, etc. So by virtue of that, those people who were asymptomatic at the time would have succeeded in innocently passing on the disease or the virus infection to a lot more people or a lot of people. So for example, if one person interacts with 10 people, and those 10 people also go ahead and interact with 10 people each, that is about 100 people. Those 100 people also go ahead and interact with 10 people each. That's a lot of people. But fortunately, the infection rate is not 100%. So it doesn't mean once you've come into contact with a person, then necessarily the person will have it. But there's a good number of people within that engagement or interaction bracket who will have it. So that is the reason why the numbers will go up. But fortunately, we've started some contact tracing, which by far is the most difficult aspect of this whole thing. Hopefully, it is yielding some results. We understand about 800 or 900 people or so have been traced and asked to be self-quarantined. We hope that it will yield good results. We understand about 200 of them have completed the mandatory 14 days quarantine and they've been discharged also. I don't know whether tests were carried out on them to be sure that indeed they were out of the woods before they discharged them into the general population. I think these are information we will need with time. So yes, that is the reason why the numbers will go up. The numbers will go up. I don't know whether the numbers have gone up enough for it to start seeing a flattening or even a decline. But let me also be quick to add that the numbers as we have today, 132, it's alarming, but it is not as alarming as it would have been to me if all these 132 people were in the population. This is because 78 or so of this 132 number came from the people who were mandatorily quarantined, I mean, from Sunday or so. So that is good. Imagine all these 78 people getting into the population and interacting with people and passing on the virus or the disease or the infection to a lot of other people. Though that particular measure might have come late, I think that it was good it came. Only that you can imagine that the same number of people might have come into the country the day before, and a few days, before. So it doesn't mean that we have a similar number of people
numbers,
in the system.
In the system.
I think
and what happens to
our
that?
agencies must be proactive. By now, I should expect that because they have the data. By now, I should expect that all people who arrive in the country, even a week before the closure of the ports, should be contacted, should be called and tested. In fact, if you tell them to self-quarantine, some of them will not bother.
It doesn't work.
You call them compulsorily and test them and be sure that they are fine and their relatives are fine. That is very important. We must do that if we are really serious about fighting this.
Okay. Bernard, time to bring in those that will make to sip through the system 2, 3, 4 weeks ago, compulsorily mandatory, because now we have some testing kits from Jack Ma. The WHO too has donated some, among others. Initially, we're struggling with that, but is it time to now forcefully bring these people in?
I think you're right, and I listened to Dr. Ansiansari today, who gave an indication that is going to happen. He's the government's advisor on health, essentially saying that trace contacts would be tested, and that testing is now a main part of the strategy, and also In fact, even before he spoke, some people sent comments to my program saying that they had come in earlier and had been contacted. So that's going well. Now, I think what is going on is that there are different levels of strategies you can apply depending on where you are. So initially, because the cases started from an outside country, your most important strategy is preventing people from coming in. That's your border strategy. I think from 21st January, from 21st March, when the president made the announcement about closing our border and quarantining compulsorily everybody, that strategy has been great. We wished he had done that earlier. Be that as it may, we have 78 cases wiser because of what he said. Because of the 132, 78 came through that process. Brilliant. The trouble is, once people seep in, it's no longer about borders. It's about contact tracing and testing. So you notice, every time they announce the figures, they also announce contacts traced. Because once people have seeped in, if your contact tracing is not strong, you've lost the fight. Yeah. But contact tracing is not enough. If you contact trace and you can't test, you are in trouble. So every stage and the new challenge you face. So we've closed the borders. We've got 78 new cases. We've quarantined them. That's great. We are contact tracing those who came in earlier. Now we need to rack up testing. Now later on, we'll talk about two different strategies to deal with COVID-19, because I'm sure you asked me about the whole lockdown. And there's a global division in the ways countries are approaching this. We'll discuss this. But my point is that where we've gotten to now, listening to the authorities very carefully, our ability to rack up and do quality tests is very critical for the number of people in the other. Because if you look at the graph that we have put on our website, the graph of those quarantined, the 1,030 people, that graph rose very steeply. But that's a control group. The broader population is still growing very slowly. Because you still have to test as many people to know those who are positive. Because as Selorm said, not everybody who is positive will show symptoms. In fact, from all the research, symptomatic versus asymptomatic is 50-50. So if there's two of you with corona, touch wood, one of you will show a symptom, the other will not. So the testing is critical. Now, what is our problem with the testing? You need test kits, which we didn't have enough of. Noguchi and KCCR, they deserve the Order of the Star of the Voter for what they've done. But the problem is, Jack Ma has given us 20,000 test kits. But test kits don't work on their own if you don't have a quality lab to process the test. We need to upgrade our labs so that the throughput of the test will be faster. Because countries that have successfully used a suppression strategy, like China and South Korea and Singapore, in the case of the latter two, a robust testing regime, in fact, Iceland presents the best case for testing. The more you test, the better you know. Because, see, this whole complex problem we are facing is a decision-making issue by governments. And the better the quality of decisions, the better the information you have, the better the quality of your decision. Testing helps you know the real state of infection so you can apply the right strategy. So for me, where we are now, the issue of racking up tests is very crucial. Because if you can't process the specimens quickly enough, you won't know who has it so that you can then contact the people who he has touched and test them. Do you follow my point? So whatever the president is doing, whatever is being told, somebody needs to be upgrading our labs to the point where they can deliver. And I'll give you an example. The 1,030 people came in on Saturday night. Today is Thursday. Not all of them have still been tested. That's 5 days. That gives you a quick idea of the, I call it throughput. It's an engineering operations term. How many can come through the system quickly? So we need to rack up our tests.
But what strategy can we employ with this situation? Because the reality of the game is we don't have the facilities to be able to rack up the test. And even if we test everybody, one, we cannot test everybody. We don't have enough kits. Secondly, the little we have, we cannot do much.
No, so I'm not saying we should test everybody. We're saying test. So we're test.
I mean, those are at least
test the right people.
The right
people.
So
So you've traced over 1,000 contacts now, I'm sure, because 2 days ago it was around 800 contacts. The first 1,030, you've managed to test almost all of them in 4 days. That's not too bad. So all the contacts you've traced, as Insiasari is saying, have to be tested. you probably will get those results by early next week. If you look at the way we're going. And of course, the new test kits are in. People will be trained to use it. So my point is that you can't take your eye off the testing ball whilst you are here. This is all that experts have made us to understand. So the testing is important. Then later on, we can discuss why people are asking for a total lockdown. Because there are two broad strategies countries are using to combat COVID-19.
Okay.
Countries which got the problem early, China, South Korea, Singapore, Taiwan, Hong Kong, a lot of them used what you call extremely harsh suppression strategies. Suppression means you lock people in a particular place, you limit the number of people who are infected to a physical location so that the virus doesn't affect too many people to mutate, to make it more difficult to get a solution.
Yeah.
The US, the UK, some of the European countries like Switzerland appear to be used initially what is called a mitigation strategy. They advise you to stay home. They don't enforce the stay home. They advise you to not go to the club. They advise you not to do this. Human beings want to move. That's why there are cases. So Italy is a classic example of a mitigation strategy gone wrong. So when people start shouting about lockdown, I can understand why they are saying this. But what I would say is that that decision has to be taken on the basis of quality information. And we assume that the president and his people have more information than all of us shouting from outside. Because, for example, they will know the order in which they tested 1,030 people to know how come we got 78 positive. So my point is that I really hope that the caliber of information informing the president's decisions are solid.
Okay.
Then the strategy will make sense.
How realistic it will be for our setting with this lockdown thing, because there are a lot of arguments around it. Whether, if you compare the various people who have been able to do the complete lockdowns or the partial lockdowns, the situations are totally different from us and all that. So in a bit, I'm sure, so we'll look at that. But before we go to the lockdown, which will be the climax of the whole discussion, let's look at information flow. Let's go back to the quarantine thing. Look at information flow. Now, I heard a couple of people on your show this week complaining about after they were quarantined, this communication between themselves and the government. They didn't know what was happening. They didn't know what to do, etc. Then later they were told, how the process will go and all that. That's one. Secondly, among ourselves, even as media and out there are the issues to do with information flow from government itself, how quickly it comes on the websites or the people that we are supposed to rely on with information and all that. Communication from that side to us, what do you guys think government can do better for it to be an easy way to also communicate to the, to Ghanaians who are, in these times quite a bit grumpy about everything. We have to communicate as effective as possible.
Yes, Vivian, I think the official government source for a lot of this information is the Ghana Health Service. Of course, the Ministry of Information is doing quite a lot in that regard. But typically, when you look at the Ghana Health Service, they've not been used to this fast-paced information dissemination. So I think this is a real, test of their capabilities in terms of how urgently they can release information or deal with things. On that score, judging from where they were and what they are doing now, they are not doing badly. But whether that is the standard or that is the optimum they should be doing is another issue. I think largely, and because this information must, in my view, pass through a number of places and authorities before they finally put them out there, I think that sometimes you can pardon them for that. Sometimes social media is in, so we hear a lot more information which filter through faster than we want to see on the websites. Somebody may be working at Noguchi, they just test somebody positive, quickly tells a friend, WhatsApps a friend that, okay, we have another case. He puts it on WhatsApp or Facebook, and we expect that. So in our minds, we add it to the tally, and we expect that the Ghana Health Service will quickly come out and then update that. Yeah. But it takes quite a more bureaucratic process than that. I'm sure it has to go through a certain number of people, checks, etc., before these things can be done. So that we can understand. But generally, I think anytime they update the nation, there are some information I think they should put in out there. For example, the number of people who have been traced. How many of those people have they tested so far? And what is the result? So don't just tell us that maybe we have 3 more cases and they just came from abroad or something. Every time we want to understand what is happening with the people who have been traced, because what happens to them will determine a lot. Yeah. For now, a lot of people are a bit not too worried. Everybody's worried, but not too worried because a lot of the cases we've seen have been imported, especially those quarantine, etc. And so far, we've only heard about 3 community or lateral infection cases, which means that largely the people with the condition now are the people who have, come from outside. That gives us some peace of mind. But once we see a lot of the lateral infections ongoing, then it means the panic will reach a higher level. We always have to know how many of the people who have been traced or those people who have had contact with the imported cases, how they are doing. Have you been testing them? How many of them have you tested? And how many of them have you had results for? That is important. We've not really been hearing that. A few times, we've not heard whether some of the cases were indeed imported or not. They just tell us 2 more cases have been reported. Yeah. We need to know all that. And even if possible, have the age profile of all these people and see how it will help in analysis and it will help in a lot of education. Bernard spoke about testing. Indeed, that is what a lot of the countries who did or who are doing better in recovery did. We mentioned South Korea earlier. Germany is even doing that. And when you contrast that with what the US itself and even Italy did, you realize that the testing is really the solution to the problem because you don't have a cure for it. Doctors or medical people only manage the situation, giving palliative care, supportive care, etc. It's an immune system fight. Normally what happens is when your system is down, you are helped with certain drugs to help fight it. But now the drugs are not there. So they just try to invigorate, if you like, your immune system so that your immune system will be able to work better, giving you certain things to make sure your immune system is stronger so that your immune system can fight it on its own. That is what we should be doing. And testing will help us get the people we should be doing those things to. And it's also good because the testing will help review the people in good time so that the treatment can start early. If the treatment if it doesn't start early, it gets to the critical stage, given the nature and the status or the quality of health facilities and equipment we have, we may be in greater danger.
I think the information thing, there are 2 things. Trust is key. If you follow the inquiries people have been sending to us when we are on air. So, for example, yesterday on the point of view, when I was closing the show, I was saying we have 68 cases. Then somebody said, there's 94. Because some people, for some reason, would think the government would hide information from them. So, for example, again, someone is saying the deaths, is it 3 or 4? We are reading that it is 4. Now, for me, the trust issue is important, and the media has a critical role to play. Now, in a situation like this, spreading panic through social media and putting on a credible platform and verified information that we find on social media is irresponsible. It's so irresponsible. Yeah, because what do you gain by telling people at 7 o'clock that 1 more person has died without verifying it? What do you gain? Okay. Number 2, the public needs to be told by both the officials and the media and all those who have a voice that the bigger the case spreads, the less detailed information you can have. All of us know the first 2 people who got COVID-19 when brought it to Ghana because those are the first 2 cases. Now, 132 cases. There's no way you're going to tell us who all 132 people are, where they went, and all of this. So you just need to arrange the information properly. How many are local? How many are imported? What age groups do you have? And today, listening to CNL, they were talking about their recoveries. Again, people need to understand that recovery, 2 things. Based on the way the condition is, there's a minimum number of weeks the disease goes through before you get healed. And then announcing a recovery is not just, I'm feeling better, I'm going home. There are tests and protocols that have to be gone through for you to announce the recovery. So you can see somebody on social media, I've recovered, thank God. That's not how it, because this is if we don't follow the standardized protocol globally, and the fact that somebody has shown you a video from a hospital that he's feeling better, Why are you not announcing the recovery? We need to let people know that there is a way to announce it. You have to do other tests so that it is certified, so that WHO knows that in Ghana, these people have recovered.
Yeah.
So a lot of people are like, how can you have 132 cases, no recovery? Are they not recovery? No. It's a process. And I think we, the media, have to play a very important... You see, we have access. When they do the press conferences, we are the people who go. The public doesn't go, so we have a responsibility. If you look at the press conference, apart from the politicians and the public servants, it's the media who is there.
That's right.
So we owe it to the public to provide accurate information and invite the right people to give the right information so that all the fear and panic on social media stops with us.
Okay. All right. You're watching what the papers are saying. When we come back, we'll look at the lockdown. Should we go for it or not? We'll find out. Stay with us. So yeah, welcome back to what the papers are saying. If you're watching us via DSTV, your channel is 363. I'm here with Selorm Adonoo as well as Bernard Avle. So guys, let's move to a shutdown. The discussion this week has been two sides. One saying we should shut, the other saying we shouldn't shut down. I mean, those who are saying we shouldn't have raised quite some interesting reasons why they believe we shouldn't. If they're saying if we compare our situation with the others that have been successful with this, I mean, the social system we run and all that will be difficult. If you look at even, if you watch CNR today, the homeless people, where are we going to take those people? If you look at our slums, how are we going to deal with issues sharing with utilities? And the reasons are on and on and on. Can we do a total lockdown? Can we do what others have done and they've been successful, realistically?
Some people say the only thing a government cannot do is to change a man into a woman. And these days, they're even trying to do that. Generally in the world, governments are arrogating to themselves emergency powers to solve the problem, whatever it takes. So they can do anything they want to do, if that is what will save us. Now, two things. As I said, in the spectrum of countries' responses, some countries have gone for what is called a mitigation strategy. The extreme mitigation means just wait and see what will happen. Tell people to just stay at home. Let as many people as possible get the virus, and then let it flatten on its own. Nobody's going to do that. Now, close to that extreme position are countries like the UK and the US who have waited and said, let's not enforce a lockdown. Let's tell people, stay home as much as you can, but we'll not arrest you for going out. Let's try and manage the movement without strictly enforcing it. Now, on the other extreme is China and Wuhan. Since January 23, people who have called into my show say they've not come out of their rooms.
Yeah.
Good. Those who want a lockdown are saying it because they feel that once there are internal infections, and once your testing capacity is not as strong, you have to assume that the number of people who have the condition are more than the figures we are being told.
That's right.
Your only best bet is social distancing, of which a lockdown is the extreme version.
Yeah.
So as I'm talking to you now, yesterday, China, almost all the, what's the name of this coffee shop? Starbucks that had closed from January 23rd. 96% of them have opened. School kids are going back to school. China did an extreme lockdown.
Yeah.
They realized the geographical extent of the problem. They forced people to stay within the same place. It was very brutal, right? But they've turned the curve. Now, those who support the lockdown say, if you don't do it as quickly and as precisely as China did, you are going to do two things. Your health system cannot cope with the spike that's going to come when the thing hits the whole population. And you're going to give the virus a bigger chance to mutate, because when the virus moves from this person to this person, it changes form. So your chances of even getting the right treatment keeps changing. Right? So South Korea did a less brutal form of lockdown, but they had more tests to accompany their lockdown. So India has done a lockdown. South Africa has done a lockdown. Almost all, Rwanda has done a lockdown. They are reading the same notes. They are basically saying that if we wait for this to go for too long, our health system is going to collapse, and the conditions, we are just going to postpone our misery. Okay? But there are people who are also saying that if I do a lockdown immediately, I'm going to collapse my economy. Too many people are going to suffer now. Okay? Now, this is what I would say. For whatever decision we take, two things are important. The quality of information our leaders have to determine whether to go for extreme lockdown, a less extreme backed by high level of testing, or a mitigation strategy. That's number one. Number two, the clarity of your objectives. What do we want to achieve? Give you an example. In the US, the reason President Trump, in my view, did not do a lockdown immediately was a number of reasons. Part of it was misinterpreting what's happening in China, thinking that the US was exceptional. Yeah. Number two, trying to do two things at the same time. Reduce the political consequence of the virus on his election chances because he doesn't want to destroy the economy. And the lockdown, because the US is a consumer-based economy, would bring the economy down. Once you have competing objectives, your decision-making quality is weaker. Mm-hmm. So for China, they are saying, we don't want this virus to go outside of Hubei because it will kill too many people, our health system will collapse, and it will destroy economy eventually. So they did their lockdown. So for me, the real question is, what do we want to achieve? What does the president want to achieve? Mm-hmm. Does he want to say, let me keep the economy going, but let me also limit the number of people dying? Sometimes in trying to solve two problems at the same time, you run into tension. So he must be more clear with what he wants to achieve. That's why when the TUC meets him and all these people meet him, he's trying to say thank you for supporting us. But he needs to be clear. If he wants to save as many lives as possible, I am tended to think he must move closer to the extreme position. Extreme one. If he feels that doing that will destroy the economy too suddenly, and that he can save the economy and also save lives, then he may move towards the... But the problem with that decision is that he may just be prolonging both catastrophes. Yeah. Because if you do a mitigation strategy, you don't lock down immediately, as people are saying, and you then say, let me not let the economy go down too early, you will just prolong the destruction of the economy. Because once people start dying, if the disease spikes to a certain level, your economy is going to go down as well. Yeah. Now, when we go to the next topic, I have a few things to say about what I'm worried about with Ghana. Okay. But I am happy with the fact that the president has asked the finance minister to do
an assessment of the
which should have been done a week ago, but no problem. Cost-benefit analysis of economic impact analysis of the lockdown. Yeah. He's improving the quality of information he has, so his decision can be better. Okay. I will give him that.
Okay. Let's bring in Selorm.
Yes, so lockdown or not lockdown, is that the question? Of course, I think we certainly must lock down at some point. Okay. I don't know whether that will be this weekend or not. I also have the suspicion that government or the president is waiting for everybody to be paid, giving 1 day to do a lot of shopping around, then you can properly stock. That is key. Okay. Because if you lock down and people do not have anything to stay with, I mean, that would be catastrophic. So, yes, lockdown certainly will happen. But I think these are some of the considerations that the president is making. What would a lockdown do? A lockdown, in the first place, will help slow the rate of the infection because people will now be compelled to stay at one place, extreme form of social distancing. It also allows the infected time to develop immunity and also to reduce how infectious they are because even though you may be asymptomatic, you can still be infectious. And whilst you are building immunity on your own, remember, this doesn't have a cure yet. Whilst you're building immunity on your own, you can still be very infectious. So locking down will help slow the rate of infection. It will also allow you to build immunity. And it also will allow the system, the health system, or even the state, to prepare properly. Because now people are contained. It will help the state to prepare properly, stock hospitals, get in more consumables, etc., to be able to deal with it. So certainly we must lock down. But what kind of lockdown are we looking at? Yeah. Is it extreme lockdown? I was in a conversation with a barber today who just sleeps in his barbering shop sometimes, doesn't have a kitchen, I think, and he eats, by the roadside. Yeah. How what is going to be the impact of the lockdown on him? Because I'm not sure people are going to be outside selling food if it's an extreme lockdown. How is he going to survive? We don't want a situation where after 2 or 3 days, people will now be so tired and hungry, get onto the street and be chaotic and want to do anything. We don't want that. So I think we need to tailor a solution which is peculiar to our circumstance and then context. My view, which I think a few other people share, is that let's identify the highly or the densely populated areas and then lock down those places. In Ghana, public transport is a key part of our mobility, of our movement. Let's lock down public transport. I was disappointed when I heard the TUC guy on the breakfast news also today say that they are willing to reduce the number of the GPRTU, the number of passengers in their cars, if government will cushion them a bit. I mean, we are in a crisis, and everybody is taking a hit, and your hit, you want government to shoulder. It means they don't even understand the gravity of the situation we face. Government should lock down public transport. Very few people can move about, and that I think will drastically help the issue. When you're moving, where are you going? You may be going to the market or somewhere to buy things. The market isn't working anymore. Maybe the market can work twice a week. Lock down the market so that movement will cease. You can't actually enforce social distancing in our markets because our markets are overcrowded.
People that when you do the lockdown, their survival depends on that
Yes,
movement.
so that is why the state must take care of people. That is why we have what we call the social protection net or safety nets. We need to activate those lines. But again, you see, we've done this to ourselves. Government established or formed what we call the LEAP, Livelihood Empowerment Against Poverty. But now when you go onto the LEAP database, you don't even find the people that the LEAP was targeted at on the database. I'm a registration officer or I work at the LEAP. You are my relatives or brothers and sisters and children. I put all of you on it. So when government is giving out the free money to those people, the monies go to people who actually do not need it. The real people are there and they are suffering.
They don't get it.
That is a problem sometimes. But government should have a way of addressing those people. In India, I think 2 or 3 days ago, they announced a lockdown. And before the lockdown was a curfew they called the Janata curfew, which was a 14-day curfew, a 14-hour curfew. The president came back, announced the lockdown, and said that for people who will be, harshly impacted by the curfew or by the lockdown, the government was going to take care of them, which means that government has ways it can deal with those people. I don't know how in our social context.
We're told in India they've been planning this for more than 2 months.
Because that's a serious country. That's a serious country. You can imagine when we started talking about this corona matter, people thought, okay, the same way Ebola didn't come to Ghana, this one too was not going to come. Even when our neighbors started recording cases, we were behaving as if nothing was happening. NIA was going about doing its registration, people were massing up at places, and we just didn't care. And here we are, we have 132 cases. 132 cases, and more tests are even ongoing. I'll not be surprised if by the end of tomorrow, the cases rise to 150 or 170. Because that is what we have seen over the... Yesterday, we were around 54. It came to around 68. And today, we are at 132.
132.
That is the gravity of the situation. Nobody knows what is going to come tomorrow. And I think we've been a bit lax in our decision-making. But, of course, some decisions have been taken. We need to lock down somewhat, but we must ensure that the weaker people in society are cushioned. And that must be done as soon as possible.
Okay. We'll go for another break. When we come back, we'll look at this NIA matter. I mean, the Attorney General has justified why the registration should go on. The case is in court. We'll look at it quickly and then we'll end. So stay with us. We'll be right back. So welcome back to What the Papers Are Saying. My name is Vivian Kai Lokko. I'm here with Bernard Avle and Selorm Adonoo. Let me take some of your messages and then quickly we'll look at the NIA matter with regards to this situation. And this is from Abdul in Tamale. He says, those of us in the north are deeply worried because there are no hospitals that have the capacity to test and give results of this virus. The laboratories must be evenly distributed across the country in order to prevent an alarming increase in the cases of this virus within the northern region. This from Richard Kotobabi. He says, I don't think we should take knee-jerk decisions because of the spike in cases. If you realize the sharp rise in cases is as a result of the compulsory quarantine, meaning the situation is largely under control. We only have to make sure that community spread doesn't escalate, but definitely the cases will increase because of those quarantine, possibly before they plateau out and finally drop. Don't think total lockdown is needed. Eric from Accra says total lockdown is the best now. And another says we have to lock down. Our health sector can't take more of corona patients. Okay, guys, let's move quickly to this NIA back and forth to register or not to register. Let me quickly read a line or two of this story that we published. It says, the Office of the Attorney General is making a strong case for the National Identification Authority to be allowed to carry on with the Ghana card registration in the Eastern region despite a directive by President Akufo-Addo limiting public gatherings. The Deputy Attorney General, in filing a defense to respond to a suit filed against the NIA by two individuals to stop the registration exercise, said, although the president gave directives for the suspension of public gatherings, the NIA's work falls under the category of businesses that were permitted to continue to operate, but with adequate precautionary measures.
I'm very disappointed with the government over this issue. If my MD gives an instruction that nobody should go to the kitchen for eating, and then he then gives an exception and says, apart from the cleaners, in making the announcement, he would have said it very clearly that apart from cleaners, nobody should go to the kitchen. If he makes the announcement and then the cleaner goes to say, well, me, I'm going to the kitchen because it doesn't affect me, because based on my understanding of what he said, I'm not part. And then my MD doesn't say anything to explain his decision.
Okay, Bernard, we'll be right back. We'll be right back. Hold on.
City TV is live on DSTV. Go to channel 363. On GoTV, access City TV on channel 182. On a digital TV, please press the menu button on the remote control and run a news search on your TV. Take note that without an antenna, you cannot access City TV on your television. City TV can be accessed on a free-to-air digital box like the GoTV and StarTimes box. City TV, it's your world.
Okay, so welcome back to what the papers are saying. Bernard, you were making some...
So I was just saying, look, the president spoke clearly on Saturday. We all heard him, right? If the president wanted to exclude the NIA, he would have said it. That's number one. Number two, since Saturday and all the NIA has been doing, the president has spoken again. He met TUC. He should have been very clear and said, this is not what I want you to do. Stay away. Now, this is what I said earlier. The three things. In the decision-making issue, number one, what's the philosophy of decision-making? Number two, what's the quality of information you have? And number three, what are your objectives? If you try and mix your objectives, if you are trying to both save people's lives, but you are also trying to make sure that you organize an election, you may make a mistake. I think we should prioritize human lives and put a stop to this thing. Do you get me? Once the NIA is gone to court, the Attorney General is arguing and trying to explain. The president today was telling the TUC that he thanks them for our support. He thanks the churches for their support. What your NIA is doing is undermining your leadership. And you should tell them to stop. Because we are behaving as if we know what coronavirus is, we can contain it. Nobody should pretend. You see, the truth is that we pray against the spike. But when the spike happens, a lot of people will not be alive to tell the story. If what we are seeing in some of the countries is something to go by. I have been to try to register for both EC and NIA. It's a chaotic scene. Okay, this is not the time to experiment your model of distancing. And the president has to speak clearly and tell the NIA, stop undermining what I'm doing, unless he himself supports them. Do you understand me? You have told the population that we are going to... Imagine if he comes tomorrow and says, we want all of you to stay home for 3 weeks, yet NIA can continue working. Does that make sense to you? So some people even feel he may be delaying on the lockdown because of this issue. So there has to be clarity. And I don't see how you are going to do something that involves a biometric registration. They say don't touch surfaces. Wash your hands, sanitize, don't touch your face. You are going to have 100 people go to a meeting point
No
queue
touch a device.
and put their hand on a device, how many times are you going to sanitize it? Do you know if it's going to work? The Olympic Games have been cancelled.
Yeah.
The budget for Olympic Games is million times our elections.
Yeah.
So the objective has to be clear. I want to save as many lives as I can. I want the curve to be as flat as possible, and I want to save the economy. We can find a way of organizing national registration. It can be a national priority under any imagination. Because, in fact, one of the reasons why we are delaying on the enforcement and lockdown is because we don't even know where people live.
Yeah.
We should have done this 10 years ago. So it's not now that you are now going to say, let's register as many people as possible. For what purpose?
Okay.
Do you get me? So
Yeah.
for me, the president should not miss this window. This thing is testing everybody's leadership. And if he fails, posterity will never forgive him.
Right.
So if people are going contrary to what he says, he should speak out. If he supports them to say, let us know.
Let us
so we
know.
can decide what we make of him.
Okay.
He can't sit on the fence on this one.
Right.
He can't.
Selorm. Oh, fine.
I think it's very unfortunate that we've had to come to this point. When the situation started, some of us went very hard on Kanatefa and said that he was putting a lot of people at risk. But come to think of it, who is Kanatefa? He's just a single person in government or technical position in government. He's not the most powerful person in government. There's a minister who sits above him. There's a minister the minister goes to cabinet. There's a president who sits above the minister. Yeah. And indeed, if it was just Kanatefa's decision, I think it would have been very easy for a minister or even his board to tell him that, stop this. This doesn't make sense. Stop it. Because what you're doing is flying in the face of the president's directive. The president, your boss, has given a directive, and you are telling us that, you are practicing social distancing. And I heard a minister or a deputy minister paid by our tax money telling us today that registration for NIA was an essential service. What kind of people are these? Was an essential service. And you see, it's only disappointing because we have a president who told us in the past that we need a leader who would think about the next generation and not the next election. Yeah. What this act is portraying is that he is thinking more about the next election than the next generation. The next generation may even die before the next election. Yeah. What is his thinking? We need to hear from him clearly that this is where we are. You see, the Attorney General is a very key position in government. He's the principal legal advisor to government. And now the Attorney General is going to court to vacate the injunction order. The injunction placed on the registration. He is going to court to argue for the judge to see sense in his argument and vacate that injunction order. What does he tell us? And he goes to court on the day that you, the president, you have told us to pray and fast. That was yesterday. So whilst the rest of the country was locked down in prayer and fasting, seeking the face of God, you have sent your Attorney General, deputy, to go to court and force the court or compel or urge on the court to vacate an order injuncting the process. I don't get it. I don't understand. I just don't get it. So I think
know something. This is very important.
Yeah.
You see, you have to be clear and you have to be consistent. Mm-hmm. And I'm saying to the president that coronavirus is testing everybody. Yeah. This may be the biggest test of his presidency. He should remember the things he said to us and take the right decision.
Okay. Thank you very much, gentlemen. Bernard Avle, General Manager for City TV and City FM, host of The Breakfast Show, and Selorm Adonoo, Head of Features and Articles here at City FM and City TV. When we come back, we have Vivian's view. Don't go away. Now, today, March 26th, 2020, Ghana's COVID-19 cases rose to 132 as of this afternoon. Just a day earlier, the number was at 68 with 4 deaths. Sadly, this number will continue to rise. To mitigate the spread of coronavirus the world over, a lot of measures are being put in place by governments to fight this virus. The Ghana Health Service, for example, has also announced 6 key steps everyone should practice to kick out the virus. These include frequent washing of hands with soap and water and the use of alcohol-based hand sanitizers, thoroughly cooking meat and eggs, eating well, and drinking plenty of fluids. Unfortunately, lack of potable water across the country may undermine our efforts in fighting this disease as a country, as 3 of the 6 things mentioned require potable water. Availability of water in Ghana is a huge challenge, not just in the villages, but in the cities as well. In the past weeks, a number of communities across the country have been hit with water shortages from the northern, eastern, and the greater Accra regions. Now, a few weeks ago, I visited a community in the northern region. It's called Shanshego. This community is just a few meters off the main Tamale Highway proper. For 7 years, this community has been grappling with access to potable water despite having a pipeline from the Ghana Water Company Limited. Though the community has a dam, when the dry season sets in, which lasts for months, it dries up. In the eastern region also, for weeks, many communities have been without clean drinking water. The shortage is not only being seen in those regions. If you come to the greater Accra region, a number of areas, including La, Teshinungwa, and many others, have been without water for weeks. Now let's look at the statistics. 1 in 5 Ghanaians do not have access to potable water, while more than 5 million people, which is about 18% of the country's population, rely on surface water to meet their daily needs, leaving them vulnerable to water-related illness and diseases and this statistics is coming from water.org. Now, years ago, our water challenges were attributed to weather patterns and limited resources. But today, the activities of persons engaging in illegal mining is contributing to this issue. A few weeks ago, officials of the Ghana Water Company Limited warned about the consequences of the actions of persons engaging in illegal mining in our water bodies and the supply of water to our homes. In these trying times, when one of our basic solutions to this pandemic is availability of clean water, which should run for at least 20 seconds, how do we ensure our brothers and sisters without potable water are covered? This is a time for authorities to take practical, drastic measures to increase access to clean drinking water across the country. Now, government must channel resources to develop our water infrastructure, and the GWCL must be resourced to ensure it carries out its mandate. We need you. Wash your hands, use sanitizers, practice social distancing, and keep safe. This has been Vivian's View. My name is Vivian Kai Lokko. Thank you for watching What the Papers Are Saying. Goodbye.